So you're here for a tour today.
Yes.
Welcome to UnityPoint. We're going to give you a tour of OB. My name's JD. I've worked at UnityPoint for 17 years. This is Jenny. She's worked here for 24 years. If you come in, Kristen, you can stop at registration if it's open. If it's not open, you can just get on the elevator and head right up. If it is after 9 o'clock at night, like say your water breaks in the middle of the night or you go into labor in the night, and it's before 5 in the morning, you can just go on around to the emergency room and register there. They'll bring you right up to OB.
And if you're having pain, it's during the day and you just need to get up here and don't want to wait for registration, there's people there and stuff, just come right up. We can still get you right up in on the floor and stuff, okay? We are a locked unit. So if you came up on the floor, if we do not see you, there's a button here you can push, just right here. The girls will see it and we'll let you right in.
So here's our front nurses station. We actually have 2 nurses stations. This is the front one. This is our unit secretary, Shirley, and she's usually here Monday through Friday, 8 to 4:30. On the computer screen right there, we have central monitoring, so somebody's actually in labor, and you can see their baby's heart rate on the top there, and then contractions pick up on the bottom. Good. The reason I'm telling you that is just because I want you to know that when we're in your room, we're monitoring you and your baby, but we're also monitoring you and your baby all the time when we're not in your room. We have 8 labor, delivery, recovery, postpartum rooms. This is one of them. So this is one of our labor delivery rooms. You come in, we'll get you a gown on. If you want to wear your own gown when you come, you have one that you want to wear, that is completely fine. You kind of hang out in here. We monitor you, watch for your labor to progress. There's a place for your support person to get comfortable as well.
So we have everything kind of built in here nicely for the room. So the monitors are all in here. We have the screens. Again, if you were in labor, we can pull up information on here, and then there would be the screen showing your baby's printout in labor. Everything's kind of hidden away and kind of opens up. Blood pressure cuffs and different things. JD can open up the baby. There's a warmer right in there. So once the baby is born, the first thing the doctor is going to do, and we'll talk to you about this, Kristen, when you're having the baby, but right after the baby's born, it's still attached to the cord. So he was going to put baby right up on your chest, if you're okay with that. We're going to ask you to help dry baby off and touch and feel the baby. He's going to hand the scissors. They're going to wait 1 minute for that cord blood
To stop pulsating.
So they'll wait 1 minute, and then he'll hand the scissors to Dad, as long as Dad's not too queasy and stuff, and ask Dad to cut the cord. And then after that, we're just going to leave baby up on your chest. Let you guys get acquainted and be happy to hold that new baby.
Our main goal right after delivery is to get that baby skin to skin with you and to start feeding that baby if you're breastfeeding. If not, skin to skin is still very important.
At some point, everybody wants to know what that baby weighs. So we'll sneak the baby over here. There'll be a scale in here, and we'll weigh the baby, and they'll get a quick set of vitals. And so that's why the warmer bed is in here.
There's a full bathroom that you and your support person can use with a shower the whole time that you're here too. So we do have toiletries if you need those types of things, but if you want to bring your own, that's completely fine. Everything that you need to take care of your baby while you're here is supplied for you. What we do is we keep it all in these drawers. So there's diapers, clothing, burp rags, wipes, and if someone was formula feeding, we do put formula in there as well. One nice thing that we like to do, communicate with you and the nursery nurses. So we have these little clipboards on the infant cribs, and it has the time of day. It also has if you're formula feeding, breastfeeding, wet diapers and dirty diapers. So if you change a diaper or you feed the baby, then what we ask for you to do is to go to that time and mark down they nursed for 15 minutes on their eyesight, or they had a wet or dirty diaper. If the baby's in the nursery nurse will do that, so when the baby comes back to you, then you know when the baby has last had a dirty diaper or ate last.
This closet is for you guys, so there's extra pillows in here and stuff for you. But I know, like, for me, I personally want to bring my own pillow when I'm here, so that's more comfortable. Do that if you want to, or boppies. A lot of women like their own boppies for breastfeeding. Feel free to that, but this is for you to put your stuff in there.
We do have DVD players in the rooms as well, so sometimes those first babies can take a little while to come, so if you want to bring a movie or something to do while you're in labor, that would be a great idea as well. It is a little bit of a smaller room. We call it our triage room. If you ever come in, you think that you're in labor, but you're not quite sure, you think maybe your water broke, but you're not quite sure, anything like that, we're probably going to put you in this room first. Figure out what's going on. If we decide that yes, you are in labor, yes, your water did break, we will move you to one of the bigger rooms like the one we just showed you. So don't be surprised if you ever come in and you go in this room first.
All right.
This is our kitchen. You and your support person can use this while you're here. If you bring in food with you, you can put it in the refrigerator. We'll put a patient sticker on it with your name so that nobody else takes your food. There is a pot machine in here that you can use as well. We do have some snacks and drinks up here, but it's limited. So if you guys want to bring snacks and drinks for the duration of your stay, you sure can. Now, we do have room service. We will get you a menu right after you deliver, and you can call down between 6:30 in the morning and 6:30 at night, and you can order your food. You call down, they bring it up to you within 30 minutes of you ordering. That way you can choose what time you want to eat, and you don't have to eat at certain meal times.
We do all of our C-sections up here on the floor, whether it's scheduled or emergency. And so we'll take you into the OR and show you the surgery suite and the recovery room.
Our OR suite and recovery room are right up here on the floor. The nice thing about that is if there was an emergency type of situation, we could have you back here within minutes. Anesthesia's here, your doctors are here. It doesn't take long at all.
So the baby is born, we're going to put baby still right on your chest, skin to skin, in the OR. So while they're still closing you up and stuff, the baby will be right on your chest. Okay?
So after you do that skin to skin with baby back in the OR, they're going to bring the baby over here and start the baby admission. Your husband will come with for that while they're finishing up the surgery. Then when they're done with the surgery, they'll bring you over here as well so you can see everything that's going on with the baby too. One thing I do like to stress though is take as much time with you and your husband and the baby after the baby's born as you want, because you will have visitors that want to rush in there. Everyone's so excited to see that baby, but you guys made the baby and you should spend as much time with that baby by yourselves as you want to. And if you don't want to be that mean person, we can do that for you and monitor those visitors.
The thing with the visitors, I would say, is some people, especially this is your first baby, you've never breastfed before. So some people are uncomfortable with that, and we do want to get babies to start feeding right away. If we can get baby to imprint at the breast, we just have such more success rate. So this is the back nurse's station, and you can see we have a large computer at the back of the wall there showing we can pull up multiple labor patients too. So if we had like 4 in labor or more, we can pull up all of them and see them on the screen. Okay?
I usually tend to hang out at whichever nurse's station is closer to my patient. So if my patient is in that front hallway, I usually hang out at that front one. If my patient is in this hallway, I like to hang out here so you're closer to your patient. I think it's nice that we have that option.